You're listening to Healing Voices Project, where we share stories and the latest information from people who fight addiction every day. I'm Mike Torville, your host and author of Voices from the Fallen. Thank you for listening, for following, and most of all, for sharing with people you care about. Make your voice count too. Hello, everybody. Thanks for coming back here to Healing Voices Project. Today, our guest is Gabriel Quaglia. Gabe is involved with so many things, and it's good to have you, Gabe, back again.
Thank you for having me.
Thanks for coming. Sure. Gabe is again involved with so many aspects of substance abuse treatment, program development, training for harm reduction. You are a servant director of the Folding Chair Project, as well as a program coordinator for support after death by overdose, which is otherwise known as SADOD, S-A-D-O-D. And also, too, you active in the union as a union steward. I don't know how you squeeze all that in.
Well, I'm no longer a union steward. Still a member of IWW.
Okay.
But, no longer a union steward. Did that for about 12 years, though.
You ran out of time?
Well, I'm just not just don't have a union at my current workplace. So,
okay.
But I still stay active.
But you do a lot of work at SADOD and the Folding Chair Project, and also a trainer, especially a Narcan trainer.
Yeah, so I am a master Narcan trainer. I had the privilege of working for the state or with the state OE&D program for about 7 years or so.
Okay.
Where my predominantly a large part of my position was training people to use Narcan properly, like overdose prevention. We used to like to call it too, because it wasn't just. Hopefully, we train you so that you don't have to use the Narcan at some point.
Okay.
So that was a big part of my work, and also doing post-overdose outreach for a number of years of going to people's houses and visiting them after they've had a non-fatal overdose, and trying to just hopefully do something for them, whatever that may be, to prevent them from having another overdose. Yeah.
Well, you have been involved in advocacy for over 12 years now. And you are also a person in long-term recovery, which, if it wasn't for that, you wouldn't be involved with the work you do today.
Probably not. Probably not. Yeah. I think it's a little over 12 years right now. October 1st, 2011 was my date of last using any alcohol, or the day before anyways. And for some reason, right around that time, I decided, start organizing in a union and getting involved in a bunch of other stuff was a good idea, as it is for most people, I think. Having anything to put their energy into, it's a big part of 12-step is having an organization you can do service for,
So you're going on 13, it'll be 13 years in October. That's awesome. That's great. And so let's talk a little bit, again, to give some context to your history, your experiences, and then what led you to all the work you do today. So let's talk about your own personal journey, where things began.
Yeah, so, we go way back, to when I was about, 15. I left home, was out on my own for quite a while.
Was that here in Massachusetts?
Yeah. Yep. I grew up in Springfield, and then I went to Northampton to, when I was living, because it was back then it was easy to live cheap. Go figure. Up in Northampton, it was $650 for rent in Northampton as opposed to maybe $600 in Springfield, so it wasn't too big of a deal. So I was there, had spent some time experiencing homelessness here and there, but never in a bad way. I was always very lucky that I had people I could turn to and would let me sleep on their couch for an extremely extended period of time, or under their stairs, which was a place I always said, if you got space under your stairs, I'm there. That's my
wow.
spot.
Okay.
Yeah. And around that time, I started using drugs and alcohol, predominantly alcohol, and kind of a chaotic way. And I moved in and out of that, not much, but I always see drug use as on a spectrum, and sometimes I would be in that moderate area where you could kind of say, well, I'm okay, but then it just kind of constantly shifted over to being in an uncontrolled area. And after many years, I think it was almost 20 years, I'd have to do the math, but I just couldn't do it anymore, you know.
Well, let's talk about that. You did this for 20 years.
Yeah.
You survived it all, obviously. You probably had a few close calls.
Yeah. Yeah, you know, it's interesting. As far as close calls go, too, like I, you know, as I was becoming a Narcan trainer, I was learning about, you know, the signs of a opiate overdose. I found out that they mirrored an alcohol overdose because they're much the same thing of shutting down your central nervous system. And, you know, it just kind of didn't dawn on me till then that my ex-wife used to always, you know, say things like, I tried to move you last night. You wouldn't move. I couldn't rouse you. You were making a weird snoring sound, which in overdose response, we call that a death rattle. Because, you know, the breathing is not completely gone, but it's labored, right? And it was quite kind of I guess somewhat of a shock to me that, like, every time that happened, which was a lot of times, I was overdosing on alcohol. Yeah.
Aside from the alcohol, you said you used certain drugs. What was your drug of choice?
Oh man, that was alcohol all the way, and then usually, you know, a lot of the stuff that I did was like kind of like an addendum to alcohol that allowed me to drink more alcohol was kind of my thing, because as much alcohol as I could get, I was, and there's certain substances that help you do that, so I was really into those at the time. You know? And
it just the mix, and then you had those what you may call alcohol overdoses repeatedly, and then you reached a point. How did this progress, and did it get so bad that you just said you woke up, you were tired of it? But there had to have been more than that. Your relationships, your jobs, how are those things affected? Your family relationships?
You know, my familiar relationships with my, you know, ex-wife were strained at that time. She was, you know, sick of my stuff, and I didn't blame her at all. You know, I think that was motivating, but, you know, a big thing, you know, there's a lot of little things kind of all going together. And, you know, I'm going to even say, like, on a spectrum, you know, same thing. Like, when I got into recovery, when I stopped using, I wasn't sure that I was going to do that long term, and it's just kind of worked out that way, you know. And my mind has changed. But the biggest thing, I think, was I was waking up outside sometimes, like outdoors in front of my house. So I'd go outside to smoke because I didn't smoke in my house. And, you know, of course, when you're drinking, you smoke a lot of cigarettes. And then, you know, it was right around September, and, like, you know, so I actually had someone, I owned a fish and chip shop at the time, and I had this guy who came in, and he passed out. He had diabetes, but he passed out outside, and, you know, had to be put in a coma. And, you know, I think he lost some of his digits a little bit, but that was running through my head, and then it happened like I don't know, maybe twice, 2 or 3 times that month. That, you know,
it happened to you 3 or 4 times.
That month. Nothing bad happened, but I was waking up outside, and I was like, if I keep doing this isn't going to work in December.
One of these days, you're not going to wake up.
Yeah.
But yeah, right. In September, you start to think, hey, it's getting a little chillier.
Yeah, and I just had no control over that. I mean, I always had stuff. I always said, too, like, drugs wouldn't kill me. I would do something stupid, which I stopped using alcohol, but I still do stupid stuff. But, like, I always used to say that's what was going to kill me, is doing something idiotic, walking into traffic, you know, falling downstairs. I used to fall down the stairs occasionally. Once in a while, I'd wake up with bruises. I had no idea what they were from exactly. And, again, my ex-wife, you know, I love her to death, you know. I don't know how she put up with that constant, you know. I put her through a lot of trauma of worrying about the fact that I was going to do something that was going to kill myself, you know, tripping down the stairs or waking up outside or whatever, or passing out and not getting up. And, but, you know, that had an effect on me after a while, too, that maybe it just took something of that level to kind of make me think, all right, well, you know, I like to be alive, so maybe I should do something about this, you know. And
when you made that decision, what happened next? Because you said, okay, I'm tired of this. I can't do this anymore. I'm going to die. I'm going to get injured. But beyond that, okay, and then what?
Well, and then at that point, you know, actually was not enamored of 12-step at that point. And I did.
Well, what enamored? Because what did you know about it? Because you didn't have a reason to be involved with it prior to that.
Yeah, well, yeah. I mean, I knew a lot of people
that were involved. Yeah, okay.
And you know, but I called up one guy, and he said, "Well, you know, it's not as bad as you think. I'll take you to a meeting." And it was like next week, but like I couldn't wait till next week, and I ended up going on my own. And I have to say about 12-step. I mean, there's issues with everything, right? But like 12-step can have issues with certain things. But as far as having a community and a place to put my energy and a place to do service and a place to meet people, and and also at the same time, at least to some degree, to work on whatever it is I need to work on, it was a great community for that. I transitioned, gradually. I got into refuge recovery and then recovery dharma as it came out, kind of like serendipitously, kind of, I don't know, I'd have to say 4 or 5 years into my recovery, which was a Buddhist-based system, which kind of I kind of took to more, and I worked with that. I started the first meeting in the area for that, and then helped develop the regional structure that we had at the time for both organizations. And again, a big part of it was service, trying to get people in the New England area to kind of work together in that. Since then, I've kind of, over the past 3 or 4 years, I haven't worked with the organization that much. I still kind of keep in touch with folks, but I think like foundationally, you need to have a community and a group of people that is going to support you in whatever it is you're going to do.
Well, that's you're right about that, and we hear that often. But what's just interesting is you made this decision to change by yourself. In fact, you said somebody said, "Okay, well, go," but you said, "No, I need to do it sooner." There wasn't a person that was pivotal to your decision. It was you. It sounds like just you on your own.
Yeah, and I mean that's how it has to work a lot of times. That's what that's part of harm reduction I'm involved with and everything. Like really, like having people who want to consciously do things is the most important thing, because a lot of times when someone tries to do something just to appease someone or to please them, it doesn't work out well. And there's other ways to kind of work with them until they can kind of they might not ever kind of feel that they have that compulsion or that desire to get involved with that. And it's like, what do we do with these folks? What do we do if if you could only say you can only go to 12-step, you can only be abstinent? That's not going to work for a lot of people at the end of the day. Right.
And in your case, when you started going on your own, you started going to these meetings, and was there doubts, setbacks, second guessing, or relapses in your case?
No reoccurrences, but like I said, I wasn't sure I was going to do it. I'd say, maybe that first 6 or 9 months too, I was like planning on what I was going to do, my thing was I was very bingey, if you want to call it that. And, I was just planning on how am I going to go somewhere where no one can see me? How can I, hide this effectively if I'm going to go do it? And then that just kind of, but that planning and that desire just kind of slowly waned.
When you drank before, was it mostly alone or with certain groups of people?
Well, towards the end, it was mostly alone, because most people didn't want to deal with
you sort of alienated some of those people.
And I couldn't even really go out to the bars a lot of time because I'd get, I very rarely got kicked out because, I managed to seem like I was okay. But, like I said, stuff would happen. I'd knock something over, whatever it was. Yeah.
Yep. Because often, too, one of the things is to separate yourself from the groups that you've either done drugs or drank with. But you were doing this mostly on your own, so it was...
Yeah. I guess I'd have to, again, I have trouble with math, but there was 35 at the time or so. And this is another big part of my story is that a lot of my friends, a lot of stuff happened in the 90s. A lot of my friends used heroin in the 90s. I lost some friends back then. I lost my first friend to overdose at 18, when I was 18. He was 20 at the time. But, and I lost people, and I was really worried about that at the time. And then over the years, people tend to get safer, or they manage their drug use, or they move away from it. And right around the time when I stopped drinking, that's when kind of the fentanyl started to come into the drug supply, and we started to see an increase in overdoses. And again, I've since then, I've definitely lost more friends in the past 5, 6, 7 years than I did in the 90s, all of the 90s.
Certainly, it's,
And a lot of the same people, the same people I was worried about for years. But, it's, that was a rough part of it, but most of my close friends and everything, they're in a safe and healthy place in their life. And I feel like I've lost a lot of, like, pretty much all of them that I was kind of worried about at this point in time.
And through your time going through the 12 steps, and you found yourself wanting to help others. That's what you're doing now, obviously, in support groups, and SADOD is certainly one that you're heavily involved with. So what led you to training, and then ultimately to the SADOD organization?
Yeah, so like I said, kind of about 7-8 years ago, whatever it was now, I started working in harm reduction. Actually, before that, I was actually active in doing advocacy for harm reduction. I lived in Holyoke, which had a great need for...
was this with an organization, or how did you...
Just kind of independently, no. I've always been involved in, city politics and things like that, volunteering for different people running for, municipal positions and things like that, and just advocating on specific issues.
Okay.
And I actually had started to, and I kind of met some of the folks over at Tapestry because they were appreciative of the fact that I was going to city council meetings and talking about the need.
Just volunteering your time?
Yeah. And, but then that, kind of got away from that. But then eventually I was looking to do something else, and I actually volunteered at Tapestry for one class I was taking at community college. And then they were like, "Do you want to keep volunteering?" And then they were like, "Do you want to work here?" And then, it was just a natural progression. But like I said, that was very much in 12-step, in my personal life, there were people I was worried about. I'd meet people in 12-step. They'd leave the program, and there was nobody would talk to them. Nobody had anything for them, and they were the ones who were dying. So I was what can I do to help with this? So, so I got into the syringe access program. A lot of, like I said, with overdose prevention, Narcan education, things like that, and of course the training component came up because I was just willing to do it, and I was always just interested in the field and learning, what the best practices were, what's going on, what's the research say, and I'm always happy to impart that. Probably one of the best compliments I ever got was somebody said, "Gabe, I like to ask you questions because when I ask you, you look like you've been waiting for years for someone to ask you that question. You're really happy to answer it instead of looking annoyed." But that's the kind of approach I take to everything. Is that there's tons to learn and talk about. Even I try to always bring a beginner's mind to everything as much as I can. So the training became a big component of that as well in my work, and then just kind of and it's kind of somewhat associated with my work in the labor movement was I was very concerned about my fellow coworkers because a lot of us were losing personal friends, and as well as losing a lot of the participants that we worked with every day. Working in a syringe program, sometimes you'll see the same person every day around the same time. Talk to them, get to know them, and that's one of the biggest things, just developing a relationship with people without having an agenda. And once you do that, you can be helpful to that person because they trust you, and you still don't want to tell them what to do, but you can show them what options they have available to them and help them make a decision as much as possible. So from there, like I said, I was working and seeing a lot of people kind of really disturbed by that loss of personal friends and the people that we were working with. And I, met the folks from SADOD before it was SADOD. This gentleman, Franklin Cook, did some research just to see what was going on across the state with, individuals and family members and loved ones, as well as the workers. Because
and you mentioned, not to interrupt you, Franklin Cook. He's the founder of SADOD.
Yep.
And how did you meet, and what transpired after that?
So, BSAS, the Bureau of Substance Abuse Services, where kind of all substance abuse stuff, substance use stuff comes under the state, under the Department of Public Health. They actually kind of asked him just to do this research. He originally worked in kind of suicide prevention and helping people deal with the grief after a suicide loss. So, he went across the state, and, I met him there, and he was just interested in what was going on. He wanted to sit in while we worked for a day, just interview us, and out of that came a report that he presented to the state, and the state said, "This is great. Okay, what can you do about it now?" And he said, "Oh, I'll figure it out." And he got Tanya and Glenn Lord, together, and the three of them founded, SADOD, or Peer Support Community Partners, which SADOD is the project of. But,
yeah, and SADOD is support after death by an overdose.
Yep.
In the long version.
Yeah.
And is there a website?
It's SADOD.org.
SADOD, SADOD.org.
Mm-hmm.
Okay.
Yeah, and it's and it's also, I always like to just bring it up that, and it's not just overdose deaths. There's tons of other deaths that kind of get forgotten, but it's for anybody who's lost someone to any kind of substance use related cause. So it could be long-term cirrhosis from alcohol use. It could be endocarditis that they got from, injection drug use. Could be Hep C, or, whatever it is. It's just kind of, the name was fit at the time, so we took to it. But it's anybody who's died of any substance use related cause. We help people, their family and friends and loved ones deal with the grief around that using peer support.
Yeah. And also, I think, to be included in that, and what's very important and sometimes overlooked, is the people who work in the field of substance abuse.
Yeah, and that's the program within SADOD. I work for the direct service provider program, or manage the direct service provider program, and we just provide supports and try to do what we can for people who are working in the field. The amount of burnout I'm seeing, like I said, I'm maybe only been in the field for 8 years or so, but the amount of burnout, I've just seen it precipitously rise. People leaving, people going to other areas, people having issues, losing colleagues and coworkers to things like suicide and overdose and other related deaths
From direct service providers that are dealing with this every day.
Yeah.
And no wonder there's some burnout there. And it's not getting better; it's getting worse, as you said. It's precipitous. Actually, it's increasing.
Yeah, it increased last year, and it's around right over 2,000 deaths just in Massachusetts every year. That's a 9/11 every year. Just here in Massachusetts. Not. I'm not even looking at the other states. We were badly hit with the fentanyl crisis. Other places were, it's still kind of getting into their drug supply. But Massachusetts is probably one of the worst as far as the fentanyl rates and the amount of overdoses from fentanyl and other associated causes. Like I said, they're not even really tracking how many deaths there are from I brought up endocarditis. They're not exactly sure how many. They know it's risen a lot, because it used to come from mostly people who are elderly, or things like dental, dental operations that they didn't, take care of their teeth, or something got in. But the rise has been huge. They think it might be as many as 25,000 deaths a year, going up in the next few years. Just kind of tracking the trend, and they're not exactly sure, but it could be as many as that nationwide. 25,000.
This is for endocarditis.
Yep. Yeah, and that's an infection that happens in the heart that they usually end up having to replace the heart valve. In a lot of the cases, the person has to do. It's a very complicated thing. But they have to do intravenous antibiotics for a long time in a clinical setting. To get them to the point where they even can operate, and then they can replace the heart valve, or maybe try to just clean the heart valve manually.
I didn't know much about that. Wow.
Yeah, it's. And it was another thing with fentanyl, and all the other infections are going up as well. But because fentanyl is stronger yet shorter acting than heroin, people used to inject 2 or 3 times a day, or up to 5, 7, 8 times a day injecting, and especially if they don't have fresh supplies, or they're in a situation where they're experiencing homelessness or something. They don't have access to fresh water. With the increase in injections and the increase in homelessness and all that, it's just kind of really all these secondary infections have really taken off. And I've been looking around for research numbers exactly just for substance use related infection deaths, and no one's really kind of trying to get a handle on it that I've seen. I'm still looking around, but it's definitely huge numbers.
Wow. Well, I want to get a little bit into the Narcan training again too, because you're a master trainer, which means also you train the trainers, right?
Mm-hmm.
And could you talk a little bit about just a quick thing? One, access to Narcan, how it's used, and what to expect when you administer Narcan.
Yeah, so Narcan these days I think is probably one of the most important first aid health interventions anyone can do.
Mm-hmm.
I think even the last Surgeon General said that the statistics that they were looking at, you're more likely to see someone having an overdose than a heart attack or a stroke.
That's incredible.
Yeah. So it's really important. Narcan access, it's pretty easy to get right now. There's lots of programs that offer free Narcan that you can go to. Tapestry Health, for instance. There's some private, other organizations that are doing it as well.
Isn't it available in some pharmacies, over-the-counter drugstores?
Right? And it's over-the-counter now, as well. It's about, I forget offhand the new over-the-counter one. I think it's like $30, $30, $40. But the expiration too is very much a suggestion. It's good for well past the expiration date usually. So if you can,
So
you
don't
can get
throw it away.
No, never throw away Narcan. You can always get in
Would
touch
an
with me.
expired Narcan do any harm?
No.
Okay, so even if it expired, you will do less harm than possible benefit.
So they've done research and they found that up to 20 years later, they went around and found a bunch of old Narcan, which must have been a fun study to do. And then they tested it, and it was over 90% of the drug still available in stuff that was 20 years old. But it's good to have, get it, keep a hold of it. You just never know when you're going to run into an overdose. Just driving around Holyoke myself, I've had 2 times that I saw someone was on the ground and I got out. One time he got up, I just started, the process of using Narcan too, which, I'll go into at some point. But, you want to just check with the person first and really loudly tell them, hey, I'm going to Narcan you. And the person, got up because it's a very unpleasant experience. That's another thing with...
Talk about that. What's it like and how do you administer it?
Yeah, so, with Narcan, it's very easy. You just have to, with the nasal naloxone that we use, it's basically you take it out of the package and you press a single button, you insert it in the nose and you press a button. It administers the dosage that way. There's other stuff you can use.
Anyone can do it.
Oh, yeah.
But you should have some training or at least some knowledge about how instead of...
Yeah, and one of the biggest things is just kind of checking those symptoms. So usually the 2 big things you want to look for is someone is unresponsive, right, and not breathing. So they're not responding to any physical stimuli. I always say to do the sternum rub if you can. And, you can tell. You can always tell. There's a million ways. They look blue. You can just see it's nothing happening. Sometimes you hear that death rattle. If those 2 things are going on, I always check with the person, try to really let one more time just with loud noise rouse them. And if that doesn't work, you can just put it in. If they're not overdosing, the naloxone's not going to do anything.
Is it similar in that to like a nasal spray? You just...
Yep, and it's just single use too. It's just a very you always want to keep them in the blister pack because that button is very sensitive. You just push it up, it distributes 1 dose, which is as simple as it can get. There's other forms like injectable that are a little more complicated. But it's always good. You really want to check though to make sure because sometimes the person will just get up if you rouse them enough, and keep moving. Of course, you want to see if they want you to call 911 and have someone look after them and all that. But you really don't want to give someone Narcan if they don't need it. If they have,
what would happen if you did?
Yeah, so anybody who's has the physical dependence on it, who's been using opiates long term, what happens is, you think about withdrawal. It kind of happens slowly over the course of 3 or 4 days, where the opiates are leaving the opiate receptors, and that makes them very sick because their body's not used to that. What happens with Narcan is it rips it all off and blocks it. So it's basically putting someone into the 2nd or 3rd day of withdrawal all at once. And they get physically ill, they're sick, they have they might have uncontrollable kind of diarrhea, they're throwing up, they have body aches, they're confused. It's a lot of confusion. And then just on top of that, when someone wakes up from an art, they're going to be confused. They don't know what's going on.
It's very startling.
Yeah. A lot of people, of course, the first thing they'll think is they're being robbed or maybe even physically or sexually assaulted. I've had a lot of women tell me that when someone Narcan them, they got very nervous. They thought they were being assaulted. So it's always good if you do have to Narcan someone, you try to avoid it if you can. But if you do, I always try to just kind of step back. I make myself as small as possible. I just try to quietly tell them, hey, this is what happened. You're going to feel better. In an hour or 2, it's going to wear off. The Narcan's going to wear off.
And hopefully they get through that. And also, as the person who's doing it, you know what to expect, so you're not startled yourself.
Yeah.
So if you have that expectation, then at least you can handle it better, obviously. And is it a good suggestion to call 911 after you administer?
Oh, yeah, definitely if you administer Narcan. Like I said, sometimes when I've roused people, they're like, no, I'm good, and just take off. That's just going to happen. You can still call 911, but if they take off, it's not going to do anything because a lot of times people just don't want to. They don't want to deal with going to the hospital, especially if they can have someone who's monitoring them. That's the most important thing is having someone that can monitor them. Yeah. But I always, if you do administer the Narcan, though, you always want to call 911, of course.
Yeah. And Gabe, if anyone wants to have Narcan training, whether it's an individual or an organization, how do they find out and get access to your training?
Well, I just personally, do Narcan trainings.
Yeah.
I'm happy to help anyone out with that.
Okay.
Anytime they can get in touch with me. They can go to the foldingchairproject.com to get in touch with me. I'm happy to help people either. And if I can't either connect them with an organization that can do it, like I said, I'm more than happy to kind of provide them with a brief Narcan training. Yeah.
So you'll refer if it's appropriate, or you'll do the Narcan training yourself.
Yeah, I'm happy.
But the best way to reach them is, and going back, because we'll talk about that in another discussion. But the Folding Chair Project, and now it's foldingchairproject.com.
Mm-hmm.
Yep. So it's foldingchairproject.com, and look for Gabriel Quaglia, our guest today from SADOD and Folding Chair Project. And see, that's extremely helpful information about Narcan training. And a lot of people, the typical person wouldn't know what to do. And like you said, it's simple, but it can be applied wrong.
And a lot of times too, if you just want a real simple, basic one, and maybe even already have some Narcan, you can contact Tapestry, and they might just be able to, drop in and give you a real quick, run through of how to use it. They're pretty good with that, especially if you have like a family member in the house, that's using, and you want to know how to use it.
Right.
They're usually more than happy to give you a brief one. You can look around online. There's some good resources online too, but it's always good to
have
do
you
it in
done
person.
And if somebody, and I'm just going to say this because maybe you already have it done, do you have a YouTube video on a Narcan training?
I don't have one personally, but there's quite a few out there that are decent. But things are always evolving, which is kind of the issue. So for instance, now, and not just to get into it, but like with xylazine being heavy,
yes,
a lot of people aren't waking up. So that's another thing I should have even brought that up.
Narcan is not effective against xylazine.
Narcan isn't effective against xylazine, but the problem with xylazine, because it's not an opiate, it's not gonna, it is dangerous. But the thing is, you might Narcan someone and they'll effectively start breathing again, but they won't regain consciousness. So you don't need to go giving them more Narcan or anything, but if they start breathing again fine on their own, you don't have to administer more Narcan. You just want to wait, because the xylazine is, a different type of, it's not a depressant, it's whatever. It's, it's a different type of drug that, basically puts the person to sleep almost, or for the most part. And because, and this has caused a lot of problems. Yeah, tranquilizer, thank you. Yeah. So it's caused a lot of problems because sometimes, I talked about precipitated withdrawal and how that's bad, and people are very uncomfortable and sick. But what would happen is sometimes, people would be giving someone Narcan and they were used to them coming back to consciousness, but they were breathing steady, but they saw they weren't becoming conscious. So they'd give them 5 or 6 doses of Narcan that they didn't need. And then when they finally came out of it, they were in precipitated withdrawal for like 6 or 8 hours. The more, Narcan you get, the longer that precipitated withdrawal
for lack of a better, it's a withdrawal overdose almost.
Yeah.
It accelerates it.
Yeah, and it just kind of it stays in their system longer. So they're like, instead of being 2 hours before the precipitated withdrawal wears off, it'd be 6 or 8 hours. And the real dangerousness with precipitated withdrawal too is a lot of people, even they might know and they might not be thinking clearly, but a lot of times they'll try to use more so that they don't feel sick, but it doesn't work. But then they already had enough that caused them an overdose. The Narcan's blocking it, and they're sick. But then they add more because they don't want to be sick. And then once the Narcan wears off, they overdose again. So it's always really one of the reasons it's important to talk to the person. Say, look, I Narcaned you. You're going to feel better in a couple hours. Using more isn't going to really help you. And of course, not giving them too much Narcan or unnecessary Narcan is really important, because it's dangerous to put someone in precipitated withdrawal for that long.
Mm-hmm. Yeah, well, as I said, it could be a simple administration, but it can easily be done incorrectly. And if so, knowing how to use it before you have to is very important. So again, I think if anybody's interested in getting in touch with Gabe, go to the foldingchairproject.com and reach out to Gabe, and you'll at least speak with him about training, access to training.
Oh yeah, for anything, relating to Narcan or training or anything like that. And if you're interested in, peer grief support as an individual or as a direct service provider, get in touch with me at SADOD.
At SADOD, that's SADOD.org. Well, Gabe, it's great talking with you. Thank you very much. Hey, appreciate your time.
Pleasure.
And we'll have you back again.
Thank you.
All right, thanks everybody, and see you soon.